Good afternoon. I'm Dr. Nardi, and you must be Miss Bienert.
I am. Nice to meet you.
And what brought you in today?
This is my cat, Chips, and recently he's been acting really strange.
Okay, what are his symptoms?
Well, he's been coughing a lot lately.
Does he have trouble breathing?
Yeah, I think so, and he doesn't even move anymore.
All right, so he's very lethargic. And what about his appetite?
Oh, it's been bad. He hasn't really been eating anything at all.
That's very interesting.
Yeah, and sometimes he just starts shaking really violently for no reason.
Huh, okay. And how old is Chips?
He's about 3.
It's really uncommon for cats that are that young to be so lethargic. Let me do a quick review of his medical history file here. So it looks to me that Chips has been very healthy up to this point and has only come in to see us for his regular checkups.
Oh yeah, he's been perfect right up until now.
All right, well, based on his previous medical history and his current symptoms, it sounds to me like poor Chips here might have feline heartworm disease.
As in heartworm, like worms in my kitty's heart?
Yeah, we'll have to do some further analysis and blood tests in order to make sure. I know it sounds crazy, but these are microscopic worms which are usually transferred from mosquitoes into the animal. Is Chips here an outdoor cat?
Oh, of course. He's outside all the time, chasing mice, all that.
Then it would make a lot of sense that he could have been bitten by a mosquito that carries this parasite.
So how are a bunch of tiny worms causing him to be so lazy and not eat anything?
Well, so the way it works is the mosquitoes carry the larva, and then they go and they bite the cat. And this larva will enter the cat's body through the bite wound, and then it will develop in the cat's tissue. The larvae migrate through the bite wound, through the bloodstream, until they enter the right ventricle of the heart and the blood vessels of the lung, where they mature and reproduce. This process can actually take up to 6 months. Larvae may be microscopic, but a mature parasite can reach up to 1 foot in length.
Oh my gosh.
Yes, it's very scary. And it is because of their impressive length that these worms can affect their host in such a drastic way.
How so?
Well, when the worms finally reach their final destination in the heart and lungs, they end up blocking the flow of blood through these organs. The heart is put under more strain as it pumps to maintain proper blood flow.
I'm not sure I understand.
Okay, well, look at this diagram. The heartworms mature and make their way into the right ventricle of the heart. Normally, blood flows through the pulmonaries as it circulates through the body. However, when this dense collection of worms resides within the heart, blood flow is obstructed, and the heart must pump extra hard in order to continue working. As you can see in this photo, the heart supplies blood to every organ and tissue in the body. When the blood flow is obstructed, less oxygen is supplied to your major organs. This oxygen is a key component in cell respiration.
So that's why Chip is acting so lazy and not moving around.
Yes, his organs no longer have oxygen to perform normal cellular respiration. This creates ATP, and since he doesn't have enough oxygen to create ATP to use for energy, he has become very lethargic.
Then why do I always hear him coughing and struggling to breathe?
That is a combination of 2 different factors. First, as I said before, the lungs receive reduced blood flow and therefore less oxygen to perform respiration. In addition, the worms that migrate and reside in the ventricles of the heart can sometimes grow so long that they extend into the ventricles of the lung. Here, they block even more blood flow through the lungs. In extreme cases, dying worms induce an inflammatory response, which eventually leads to pulmonary tissue destruction. The loss of function in the lungs is what causes this difficulty in breathing.
And I bet that reduces oxygen flow to the organs even more.
You're right. As the worms grow and affect more body tissue, the symptoms get more severe.
Wow, this is intense. And what about the violent shaking?
Our body moves via signaling from the brain to our muscles. These signals travel by neurons, which send information in the form of action potentials. Neurons are all over our body, constantly sending action potentials to target organs. Neurons in the brain that are responsible for skeletal movement require a specific amount of oxygen for normal function. With heartworm disease, these neurons become starved of oxygen and actually start acting abnormally, firing action potentials in an uncontrollable manner. The action potentials arrive at the muscles and make them move spontaneously, causing seizure-like movements.
Oh, so that makes sense. So are you saying he actually has heartworm?
Well, like I said before, we're going to need to run a blood test in order to look at his levels of antigens and antibodies. An antibody test will detect his exposure to the heartworm larva.
Okay, and then that will tell us for sure if he has feline heartworm disease.
Well, maybe. Heartworm disease is relatively difficult to diagnose in cats, and it is not much like heartworm disease in dogs. In order to confidently diagnose Chips with feline heartworm disease, I would like to also do a chest x-ray and possibly an ultrasound.
What would those tests tell us?
Well, the blood test will tell us if your kitty's blood contains the antibodies to the parasite that cause heartworm disease, and it will tell us if the adult heartworm proteins are present in his blood. The X-ray and the ultrasound may be able to reveal the presence of heartworm in the heart or in the pulmonary vessels.
Okay, just do whatever you need to do in order to confirm the diagnosis.
Okay, I'm going to leave real quick, and I'll be back in a few minutes with Chips and his test results. So it looks like Chips has tested positive on the antigen test, and the ultrasound shows that he has a few worms in his chest.
Is it a good thing that he only has a few?
Well, not necessarily. Cats usually have 6 or fewer worms in their heart and lungs when diagnosed with heartworm disease, and it is possible that just 1 or 2 worms in a cat can make a cat very, very sick.
So how do we treat him?
Unfortunately, there is no approved drug therapy for heartworm infections in cats. While there is a drug that's used to treat the infections in dogs, this doesn't work for cats. It's not safe on them.
So is he gonna die?
Well, depending on where the worms are in Chips' body, it is possible to surgically remove them via the jugular vein.
That doesn't sound good.
Deaths have been reported for this procedure. In these types of situations, the best thing to do is treat the symptoms of the disease and to make the patient as comfortable as possible.
So how do we do that?
In order to treat his coughing and wheezing, I'm going to prescribe corticosteroids. And if his seizures become more severe, we may need to perform emergency oxygen therapy via an oxygen tank or an oxygen mask or gas chamber to supply his brain with oxygen.
Will he live?
Fortunately, heartworms in cats live much shorter than heartworms in dogs. So with the right treatment, as I just talked about, there is a chance that Chips will outsurvive these worms.
That's wonderful.
Chips is a strong cat. I know he'll make it.
Thank you so much, Dr. Nardi.
Let me go get those corticosteroids for you.